Before basic training, soldiers were screened through a series of tests and movements. Using the results, some of these trainees were referred to IPREP at the fitness training unit, where they will spend 3 weeks learning about injury prevention and increasing their overall physical performance.
Musculoskeletal injuries are a big problem, not just in initial entry training, but in the Army and the military as a whole. And I think if we can establish this knowledge base on future soldiers, hopefully we can begin to work on this rather large problem.
Today, these soldiers will complete 7 movements from the functional movement screening, which are scored on a 0 to 3 scale. If they can't perform at a level 3, they are given an alternate position to repeat the movement. Their scores will determine what exercises soldiers can use to help correct any deficiencies.
The goal with that is really twofold. One is identify weak links that might make them prone to injury, and then to develop corrective exercises that are going to correct those weak links, make them less prone to injury, but also make their bodies more balanced.
Other strengthening exercises are implemented throughout the 3-week course, such as total body resistance exercises, or TRX, where soldiers use body weight resistance to challenge their mobility and stability. In order for these soldiers to complete IPREP in 3 weeks, they must score 14 out of 21 points on the FMS screening, complete 20 sit-ups in 1 minute, 20 push-ups in 1 minute, and run a mile in 9 minutes.
The IPREP is important because we're making sure we take care of our most precious resource, who are the soldiers. And by doing that, by creating this program, we're trying to reduce injury rates.
Roll those heels to your buttocks.
But physical performance isn't the only aspect the cadre analyze. In order to get a holistic view of the soldier, they look at character and personality. There are 4 pillars to IPREP: physical performance, injury prevention, soldierization, and mental resilience.
Are they performing poorly, but what's their motivation and effort like? Do they look like they're going to be a good soldier, somebody that's going to be successful, not likely to get injured downrange, but just needs a little more help in the IPREP?
After spending 3 weeks in IPREP, soldiers are typically well prepared to continue on to basic training. Katie Cook, Fort Benning TV.